was in the afternoon, I was reading, and I pick up the phone, and it's this guy with a very heavy accent, and he goes through his whole spiel, hi, I'm calling from the heart transplant program. He said, we need you here in 3 hours. Okay, we have to leave now. And we pulled up to the main hospital. It was the first time I'd ever been there at night. Basically what happens is the team that will be operating on you flies out to wherever it is. In this case, the heart wasn't close by. And at that point, they wait because they will not take the heart out of the donor until you, the recipient, is physically at the hospital. And at that point, I was being prepped for surgery. They put me out first, and then they brought the heart in. At 13, I was diagnosed with hypertrophic cardiomyopathy. I was running on a treadmill in the garage, and I just went into a cardiac seizure, had a implanted cardioverter defibrillator put in. So that really changed the trajectory. It was no more sports anymore, no more contact anything. So after almost 10 years of having hypertrophic cardiomyopathy, it was determined that the heart was too sick now to continue working in the same way it was before. It's a difficult emotion because you want the call so badly, you're so tired of waiting, but you also don't want the call to come because you want to spend time with your native body and you don't want to be invaded. And transplant is obviously a massive surgery and there's always the risk of complications. And more than that, I really identified with HCM. I kind of didn't want to lose it because I knew what it entailed. I knew at that point how my heart worked. I mean, it was a piece of me. And you also didn't want the call to come because you knew what that meant for the donor. And I really don't like that train of thought. I think there's a lot of people in the transplant community who think, oh, someone had to pass away for me to live. I'm much more comfortable sitting in the zone of someone was going to pass away anyway, and it's wonderful that they're making the choice to let somebody else live on. It took a long time for me to feel anywhere close to my old self. It's really incredible to be able to get through a full workday and have the energy to do so, to be able to go hiking with my friends. And there's so much gratitude that goes into the fact that people are willing to donate their organs. And so you really realize how fortunate you are. But that's not at all mutually exclusive for the shit you go through once you have it. I think I've been trying to navigate that balance of gratitude and realism and relating that to other people who have chronic illness. You can still be very lucky to get a transplant. You can still have an incredible support network. You can have no complications, and you're still allowed to be mad at the universe for giving you this problem. Even though I feel like I've aged 10 years in the last year, I'm also very grateful for knowing that possibly the most difficult part of my life is behind me.